we are organizing the 37th Microcon 2013 program at HICC Novotel. This is about, this is an annual meeting of the IMM. So this is an annual meeting of the IMM which occurs across the country every year, and this time it is in Hyderabad. The Department of Microbiology, Nizam's Institute of Medical Sciences is organizing this conference. There are about 1,000 plus delegates who are participating this year. The Microcon conference theme is clinical and applied microbiology and the future trends. That means all these years we have been doing laboratory work, the microbiology people, but now we want to move into clinical microbiology so that it will be more useful to the patient care for the clinicians also. So since yesterday the program started, it started with the inauguration of the function by the Governor, Sri ESL Narasimhan, and then it was followed by a keynote address by the Director General of ICMR, Sri V.M. Katuch. Both of them emphasized the need for improving clinical microbiology and the diagnosis, and some kind of a collaboration between the clinicians and the microbiologists as a network across the country. So everybody should work in union. After that, from today onwards, the program started, and we are having several lectures on so many kinds of infectious diseases, right from bacterial infections to viral infections to parasitic and mycobacterial infections. So since morning we had some award oral presentations, orations. In that, the speakers highlighted importance of pneumonia and tuberculosis and some kind of bacterial infections. Now in the afternoon sessions, we are having sessions on hepatitis, HIV by eminent speakers both from India and abroad. Right now one person, Dr. Bharat Parekh, he is speaking on, he is from CDC Atlanta, he is speaking on how to diagnose HIV infection at the earliest. And then we have 6 breakout sessions in which we have called clinicians also to this meeting, so that they help us, or they talk about what they are actually seeing at the clinics, how they are approaching a patient with infection, trying to diagnose and properly manage those cases. So this conference is, as I said, the theme is from the bedside, that is in the laboratory, how we can translate the results to the bedside for the patient care and proper management. So for the next 2 days also, the conference will be running on the same theme with eminent speakers and clinicians discussing their experience, their research work and the management trends. And of course we have exhibitors who are exhibiting their products, both machinery as well as diagnostic kits, which are based on advanced technologies for diagnosing infections at the most fastest way possible, at the earliest way possible. So this is the advance that is taking place. It has been changed, transformed from a conventional technology to advanced technology and molecular real-time technology. Lastly, I would say that we have oral presentations and poster presentations by young students, microbiologists, who are presenting their experiences on what kind of research work they are doing, and some kind of a data analysis of the results that they're seeing at their own laboratories. And finally, we have some programs which are highlighting the need for proper and targeted medical education, so that we get better educational tools rather than what we had previously, so that the microbiologists understand the need for clinical microbiology.
And lastly, a brief introduction about you.
Okay, I've told you I'm Dr. Lakshmi, Professor of Microbiology, Head of the Department of Microbiology, Nizam's Institute of Medical Sciences, Hyderabad.
The number of participants
I've told
and
that.
speakers have come from all over.
I told.